Hello and welcome. My name's William from the Brilin Functional Medicine Centre, and it's a real privilege for me to interview David Walsh today. David, you're a dentist, and I never thought I'd ever be saying it's a pleasure to see a dentist, but here we are. Thank you very much.
Well, you're not quite seeing me in my usual professional capacity, so you can feel reasonably secure. Not much is going to happen.
That's good. Look, the reason I want to talk to you is because, as you know, at Brilin, we really value oral health. In fact, it's a critical component, especially if you have a chronic condition. And we've sent probably hundreds, maybe even thousands of contacts your way. So that's what I'd like to talk a little bit about now, is about oral health. But I'm just before we do, I just saw this here. Here's a power adapter whereby you can plug many items in. Now, Dave, if I plugged in, say, a computer, and then a heater, and then a lamp, and then maybe a phone charger, and when I plugged the phone charger in, the fuse blew. What blew the fuse?
Oh, the straw that broke the camel's back. Combination of everything.
Yes, exactly. Yes. So
that's the way it
often with health, there's not necessarily just one precursor that causes a health problem. Often it's a whole lot of cumulative things that can essentially blow your fuse to your health. But what I'm trying to get at here with you tonight is that in some cases, I think that heater can often be our oral health. That can be the real tripping point of someone's health.
I hardly agree.
Yeah. So, David, obviously a lot of people at the moment are concerned about their health. They might be concerned about getting COVID. They might be concerned about some medical treatments that they've performed. Where do you see oral health being important these days?
Well, everybody talks about COVID being dangerous, particularly with comorbidities. Same with the vaccine, comorbidities causing things. And oral health, the mouth is the black hole of medicine. I mean, doctors don't look past it, and dentists tend not to look past it. And the connection between the mouth and its parts with the rest of the body and systemic health is profound. I mean, even if you look at gum disease itself, it's an underlying bacterial infection that is drip-feeding bacteria into your body continuously. And as you know, inflammation in one part of the body leads to inflammation in the rest of the body. And so you get cytokines released from the inflammatory area, and it'll work on your body and find the weakest link. And so if you've got osteoarthritis, if you have early dementia, or even cancer, these things can be exacerbated by what seems unconnected inflammatory processes.
I've heard many doctors speak around the world, and some of them say that infections and some issues with the oral health can be the number one precursor to a lot of autoimmune diseases and cancers.
It's directly linked mathematically to so many different things, but the problem is people don't draw a direct line between my gums are bleeding and pica disease. Because there seems to be a sort of a disconnect between people and their mouths. If your thumbnail bled every time you flexed it, or pus dripped out from between your fingers, you wouldn't ignore it and say, it's okay, my finger's just bleeding when I look at it. You'd be concerned. And in the mouth, because we can't see it, we can't really feel it, it's symptom-free. It tends to be disappear into the background, meanwhile causing chronic inflammation in the body.
And I understand it, I'd love you to correct me if I'm wrong, but I understand it that it's not just the bacteria, but it's the poop from the bacteria that is almost like a deadly toxin, and there's no protection for it to go straight into the blood.
Absolutely. What's in the mouth is in the body.
Yeah.
Absolutely.
And so where does it play a role with potential of, heart attacks and problems like that?
Well, it leads to systemic inflammation. And so if you've got some cardiovascular problems or which tends to be related to circulation and LDLs and all those sorts of things, it will exacerbate that simply by virtue of sending these cytokines around the place.
So what's the solution?
Keep your mouth as healthy as possible. Come see me.
How can people do that?
Well, mainly it's keeping inflammation, any source of bacteria minimized. I mean, the mouth is teeming with bacteria anyway. So we want to minimize its access to the body. And that is open decay. It is mainly through gums. The attachment between the gum and the root is a very thin barrier between the body and inside and out. And so it's essentially oral hygiene. It would be the big one in terms of gum disease. And then we can talk about toxins and things and fillings and so on as well. if you want to go down that path now.
Well, you know, one of the main reasons we send people your way is mercury fillings, because we know that, you know, every time you chew, bite, there's an odour of mercury, so to speak. There doesn't appear to be a blood-brain barrier with mercury.
No.
So that causes another whole host of domino effect of health problems. And actually, this is a good question. Most dentists can remove mercury, but what is it different about you, and why am I recommending my clients to you?
Well, if you take a drill and whip out a mercury filling, you're vaporizing the whole thing. And so mercury vapors will be released when you touch mercury filling with a drill. And mercury vapor is freakishly toxic and instantly absorbed. So what we use is something that's called SMART protocol, which is Safe Mercury Amalgam Removal Technique, which is all around protecting the body and creating a barrier between what I'm doing and what your body can be exposed to. And the parameters that, or the big ones, are clean air to breathe and a rubber dam. Rubber dam is a diaphragm that wraps tightly around the tooth. So we isolate each tooth first, and then the rubber dam comes up over your nose, so you're not breathing through that. We give you some oxygen to breathe that runs behind the rubber dam. And then we've got a suction machine that you can stick yourself to the ceiling with. I mean, it creates a wind tunnel into the suction. Yeah. And then when we take out the amalgam, we don't just drill the thing out. I try and create weak spots. Amalgam is mechanically held in teeth through undercuts or locked in little bits. So I use my crystal ball and try and find where those weak spots are and take it out in chunks to minimize exposure. And then behind all that, we also do some heavy metal chelation at the time. We use something called Tox Prevent, which changes the gut's permeability to heavy metal ions for about 24 hours. So yeah, we drink of that right before we start, which just mitigates anything that might sneak in behind the rubber dam.
Another problem that some of my clients have been mentioning is they want to go to see certain specialists, but they're now not allowing anybody who are unvaccinated to attend. You know, do people have to be vaccinated to see you?
No. I think the vaccine itself is a personal medical question. I'm against the bigotry around the identification of whether you're vaxxed or anti-vaxxed. I do have concerns about seeing people who are recently vaccinated, simply because of the concerns about shedding and so on, which I've actually experienced myself. But ongoing, absolutely not. I will not ask if you're vaccinated or anti-vaccinated or not vaccinated. I wouldn't expect people to ask me. I'm walking down the street. And I'm vehemently opposed to anything that contributes to the two-tiered society that seems to be coming our way.
No, that's right. And you know, on that topic of vaccinations, that's one thing that concerns me, because I know that when you have bad oral health, it can stimulate inflammation in your cardiovascular system, in your veins, and your arteries, and your capillaries. And a lot of these COVID vaccines have been known to cause a lot of microclotting. And I'm thinking, if you've got bad oral health and a vaccination, those two that go together might be an issue.
Of course, as with any underlying problem, if you're not metabolically healthy, a big part of which is oral health, obviously, then those factors of the vaccine will have a greater effect. I mean, I think the best way to mitigate things around the vaccine, if you really need to get it, is just to spend some time cleaning up your body, being as healthy as possible. But that's a way of life, really. I mean, we should be living that way anyway, but a lot of us aren't.
Yeah, and part of what I'm talking about tonight is, you know, because some people may not, or they feel they might not have a choice to get jabbed. And so what's the solution? Well, first of all, you just need to eliminate every single inflammatory response. Correct. And so if you knew that you had to get jabbed because it meant your job or you got family pressure, then oral health has to be looked at. You must get on top of that, those conditions, as long as all the other things as well.
Well, it's one of the things that needs to be dealt with. It's also one of the things that you are able to deal with. There's an awful lot of stuff going on that you can't directly affect, but oral health and its systemic implications can be treated and sorted and stabilized. So we can take that off the equation, take it, you know, put it in the good box instead of the dangerous box.
Well, look, I really appreciate your time. But before we leave, is there anything else you'd like to mention regarding the subject tonight?
I guess the toxicity of what we put in the mouth is a factor. We're now finding that composites, like when I talk to people replacing their amalgams, even within the replacing composites, which are the classic white fillings you'll see, we're now finding BPA and other phthalates in gluma and HEMA, titanium dioxide, and some of these things are being released from the filling, and they are measurably absorbed by the body as well. So It's just a question of being as low tox as possible. And they tend to be fine for almost everybody. If you've got white fillings, don't go and get them replaced. But some of the BPAs and things, we don't drink it out of a cup, so why would we chew on it for the rest of our lives? And there are filling materials out there that are free of all these things.
It kind of makes, it's just a thought's just hit me now, like, anyone that challenges the mainstream narrative in terms of what's going on at the moment is anti-science. But if has anyone challenged the mercury fillings? Because that was science, wasn't it?
Yeah, it was science. Lots of things were science. And I spent 10 years putting in amalgams, and 25 years not. Yeah. Because I was of the opinion that it's bound, that mercury, once it's bound to silver, is inorganic and inaccessible. That's not true. If it's exposed to bacteria, it's converted to a bioavailable form of mercury, and it's released and absorbed. And that is scientifically proven fact now. And
something that's science but not tested or proved is the fact of it's not just mercury in there, it's a combination of metals, and there's been no studies to indicate the safety of having multiple metals in the mouth.
We just don't know.
Yeah. And I also understand that, like, if you've got a gold tooth and mercury, that's a problem because it can cause a bit of a voltage.
Of course, you've got dissimilar metals connected by saliva. Saliva's water. It's a beautiful conductor. Who knows? Yeah. And that's a really hard thing to measure, but there are people with galvanic measuring devices. I don't particularly have one. But I've always been cognizant not to put dissimilar metals in the mouth. For example, I won't put a gold crown over an amalgam filling. And the other thing is, when you get these electronic potentials between the dissimilar metals, of course that electronic potential is releasing the ions. And so it's all, my personal opinion, the standard of care in New Zealand is that amalgam is still fine. And it's a personal decision. You do your own research if you want to look at getting it removed. I personally place myself in the position that if you're trying to be as healthy as you can, then having these fillings in your mouth is probably a negative for an awful lot of people. Yeah. You can't draw a straight line and say mercury is killing you or root canals are killing you, but you can say, right, given your immune system, given the situation, given the possible toxic stuff, the stuff you might be dealing with chronically, then it may well be a good idea to get these things safely changed over.
It is always a contributing factor, though, towards the health. And look, I have seen people, and there's dentists down south that we've recommended too, because obviously they live down south. But we've had someone that's gone, had fevers every night. They've gone to the dentist. I'm pretty sure this one was you. They removed something that shouldn't have been there. And 2 days later, they rang me up saying they're finally not getting any fevers through the night, and the healing was quite quickly. And that was actually a guy in his 80s. Yeah. And so we've witnessed it. We're not dentists, so we're not allowed to give any dental advice. But by gum, we certainly have enough data to suggest that if you've got that particular oral health condition and you've got this chronic disease, you will not heal from that chronic disease until you get that fixed. Yeah. And we've seen it, and it's quite shocking.
I've seen some profound. I've been doing this for 20 years, the holistic side of dentistry, and I've seen some. Most people feel it's the best thing they've ever done. A few come back with a radically changed health scenario, which we can say, right, this is when it changed. And there are a couple of very clear examples where it's A equals B. But if you search the literature, it's pretty hard to find, because usually people that are coming to get their amalgams removed are also changing their diet. They're pursuing other health things. They're meditating. They're getting a good night's sleep. And so is this the one factor? Occasionally, I would argue that it is, but it tends to be wrapped in with a bunch of other health stuff. Yeah, exactly. And so I think it's absolutely critical. Yeah.
Well, thank you very much, Dave. It was a real pleasure to have you on tonight. And how do people find you, by the way?
Oh, Dentistry on Merivale in Christchurch.
Okay. Thank you very much.
I'm pretty easy to find. The big Canadian dude down at the mall.